we will be presenting migrants and threats to healthcare in Malaysia. So this will be our content and I'll begin with the introduction. Okay, migration is defined as a process of moving either across an international border or within a state. So to date, United Nations has reported that about 232 millions of international immigrants across the world, and every year it is progressively increasing. And one of the largest regional migration is occurring at the Southeast Asia and toward to the Middle East as well. And most of the countries, people tend to migrate as migrant workers. Okay, there are two types we can categorize the migrant workers. For the poorer nation, migration is seen as a survival mechanism, whereas in the developed countries, migrant workers are seen as those who can help to fulfill the necessity of the essential job. So these two group of people eventually were known as migrant workers as a whole. So what is the role of Malaysia in this aspect? Malaysia, they plays both roles, importer and exporter. And what Malaysia do is they will import all the low skilled laborers from other countries and they will export to a more developed countries. And today there are about 6.7 million of foreign workers in Malaysia, out of which 4.5 million are illegal immigrants. Okay, what is the possible health threat of these migrant workers in Malaysia? So according to the Deputy Minister Dato Sri Dr. Hilmi, he said that there is an increase of tuberculosis infection among the locals in the country has been reported in the in this few years, okay, due to an influx of the migrants. So is this one of the evidence that migrants can pose the threat to healthcare in Malaysia? Is it due to their changing lifestyle, living condition, or socio-economic status? All this will be further discussed in our presentation. So before we go further into the problems that are faced and what are the solutions to these, my colleague will further explain about the terms and the conditions that will be used throughout this presentation. Thank you.
Good afternoon. So before we actually go into the main topic of today, there are a few terms and definitions that we have to know. So first is the migrations. So migration actually is the process of the permanent or semi-permanent relocations of a people from one place to another place. So there are a few types of migrations. Voluntary migrations, it's a migrations by the individual. So they choose to leave their place by their own will. Involuntary migrations that they forced to leave. For example, maybe there's a war in their home region, so that's why they forced to leave their home region to another country. So internal migrations is a moving to the new home within the same state or country. External migrations is a moving to the new home at different states or different countries. Return migrations is the migrations of a group of people back to where they are originate from. Migrant is the individual who actually move from where they are originate from to another area. So the migrants can have a different aspect. So one of it is the political migrant, whereby people actually forced to migrate due to war or the states of policies, or maybe they have been discriminated against a particular group of people. Then we also have the environmental migrant, whereby people forced to migrate due to the change in their local environment, maybe due to some natural disaster. Family reunion is a form of a migration whereby all the people migrate to the same country, which is another country whereby they are not originate from that country, but they actually migrate together to join with their family. And then there as well as the economic migrants, whereby the people move from one country to another country for the advantage of the greater economic opportunities, such as some work. Documented migrant is a migrant who actually lawfully moved to that country according to the admissions criteria approved. Irregular migrants means those persons who entered the host country lawfully but have stayed over the authorized period of time, so they remain unauthorized employment or illegal to that country. Skilled migrant is that they migrate to the new country with their professional skill that is required by that particular country, as well as the temporary migrant worker, whereby this worker actually they work in another country with the work contract with a private sector for some period of time. And emigrations is leaving one country to the new place, and emigrant is the persons that move out to the original country. Immigration is moving into the new country, and immigrant is the persons that enter into the country. So Rania represented the issue related to the healthcare, and that's it for my presentation. Thank you.
Hello, good afternoon. What are the issues related to healthcare? Some of the issues related to healthcare is the first one. It's actually if migrants move from one country to another, that means there is a lack of good healthcare system in the country of origin. And then they also believe in their own cultural beliefs and norms which impact health. And then there will also be a language problem, occupational hazard, and lack of access to healthcare. This will cause poor nutrition, lack of resources to seek care early. And also there will be overcrowding and poor sanitation. All this contribute to the issues related to healthcare. And also there will be low income status and unfamiliarity with the culture. This will all compound into the problem of a migrant worker that is working in another country, and this will have impact on their health. And migrant workers are of increased risk of contracting a variety of viral, bacterial, fungal, and parasitic infections. Some of the challenges in monitoring migrant health: number one is diversity in source data. There will be different definition and denominators, and there is dynamics of modern migration. There will also health effect of migration extending beyond first generation and access to some populations or communities. Important aspects of migrant health include basic and important aspect. The two basic and important aspects of migrant health include the migrants. They share many common health influences and outcomes with their population groups. And the second is the health influences and determinants directly relate to resulting from migration. Foreign Workers Medical Examination Monitoring Agency, it's the only authorized agency to manage health screening for migrants, and it's under the Immigration Act. Under the deal, for MEMA, which is the Foreign Workers Medical Examination Monitoring Agency, also required to provide health records of the workers to the government annually. And there's also new regulation enforced on August 1st, 2005. This stated that legal migrant workers now undergo medical examination within 30 days of their arrival in Malaysia. Now I'm going to give it to Meenakshi to continue with the solutions.
So some of the solutions can be, am I audible? No? Anybody?
Yeah, we can hear you.
Okay, thank you. Some of the solutions in healthcare services, first would be availability, where it should be made available for the migrant workers. In case of countries that have adequate public health care systems, migrant workers often don't have access due to legal status, discrimination, or cost. The cost of consultation, and this is accessibility, where the cost of consultation, tests, and medication that migrants pay out of pocket should be reduced to minimum levels and elevate the economy accessibility of the migrant workers. Extra consideration might be necessary to increase accessibility to health service for migrant workers, and then appropriate language services should be provided. Setting up health facilities or services within the workplace and rearranging opening times of local health services to accommodate the migrant workers. Acceptability. It is a culturally sensitive approach toward migrant workers. Health concerns will improve acceptability of the healthcare services. The employment of culturally competent healthcare providers, mediators, or interpreters will help to reduce cultural and social barriers. If the medical care providers have a bias towards these towards these migrant workers, then it becomes a problem. So that needs to be removed. Then the quality, employers should offer in-house health programs to these migrant workers. Then employers should also have procedures for caring for a migrant worker in the event of medical emergencies. Health insurance. A recent announcement by the Malaysian government requiring employers to buy health insurance coverage for migrant workers has been made. And it is being implemented mainly because of the high amount of unsettled public hospital bills by employers, totaling nearly about 18 million ringgit as of November 2010. To date, the details of health insurance apart from annual premium of 120 ringgit have not been made known to the public. Monitoring migrant health. We need to ensure the standardization and comparability of data on migrant health. Map good practices in monitoring migrant health. Policy models need to be changed, and health system models also need to be modified. Support the appropriate aggregation and assembling of migrant health information. Policy and legal framework. We need to adopt relevant international standards on the protection of migrants. We need to extend social protection in health and improve social security for all migrants, and implement national health policies to promote equal access to them. Migrant-sensitive health systems are necessary. So we need to ensure that health services are delivered to migrants in a culturally and linguistically appropriate way. As I mentioned earlier, it needs to be accessible and it should be easy for them to understand what is being told also. Enhance the capacity of health and relevant non-health workforce to address the health issues associated with migration and deliver migrant inclusive services in a comprehensive, coordinated and financially sustainable way. Partnerships, networks and multi-country frameworks need to be established and they should support migration, health dialogues and cooperation across sectors. So basically there should be an intersectoral collaboration in this direction. There should be address of the migrant health matters in global and regional consultative migration, economic and development process. Sir? Am I audible?
Tell me. Yes.
Oh,
Now
sorry.
it's no problem.
So the reflection and conclusion is Purvi's part.
Purvi's part, I mean, you can continue if you have the portion.
Oh, okay.
Right?
So,
yeah.
With everything that we have actually seen till now, including the issues and the solutions that we have come forth with, I would like to reflect that while Asian member countries have signed the Declaration on the Protection and Promotion of Rights of Migrant Workers, the health rights of migrants still need to be addressed, especially with ongoing universal health coverage, USC reforms in most ASEAN countries. Malaysia is not party to the 1961 Convention relating to the status of refugees or 1967 Protocol relating to the status of refugees. Refugee status does not exist in Malaysian law, thus refugees are seldom considered as irregular immigrants. For instance, Thailand allows undocumented migrants to opt into its compulsory migrant health insurance scheme, whereas Malaysia and Singapore are still yet to consider including migrants in their government-run USC systems. With this, I would like to conclude that thus, by improving migrant health coverage, Malaysia can make USC systems truly universal. Then migrant inclusion in USC is a human right imperative, and it is in ASEAN's best interest to protect the health of migrants as it pursues a pathway towards collective social progress and regional economic prosperity. It also needs to be emphasized that local and migrant workers have to be treated equally as part of the ASEAN agreement, with protection for migrant workers, especially domestic workers, in terms of labor and health rights. Thank you.
Okay, thank you very much for the nice presentation. Now you can start the discussion.
So I'll go through slide one by one, and then if there's any question, just stop me, okay?
Okay.
Okay. Do we have any list of total migrant population in Malaysia?
Not that I'm aware of, no.
We don't have the total migrants in Malaysia at the moment, but we have a statistics that foreign workers in Malaysia is around 6.7 million.
Oh, that's a
Yeah,
big number.
yeah.
And then majority are from which place?
Mostly, currently, most of the foreign workers are from Bangladesh and Indonesia.
Okay.
Yeah, the main supply, but others we have from Philippines, India,
Now
and
the Indonesians, right? Actually, right, our migrants, our immigrants, right? It's mostly from the Indonesia because of the palm oil.
yeah,
But now Indonesia they have their own palm oil business already. So now they started the trend started to change already. So instead of Indonesians, most of them are
Bangladesh.
Philippines.
Philippines.
Yeah.
And what is going to take place in the next year is our government is going to bring in another around 1.5 million of Bangladesh foreign workers to Malaysia. So that will increase our number of foreign workers in Malaysia.
Did you get any opportunity to talk to any one of them, any of the migrant workers, and interview them for their problems they are facing?
Ah,
Okay, at our church here, one of the worker is from India. Basically, he's not facing any problem in Malaysia because whatever he needs, I mean, like a health services or a place to stay, accommodation, everything is being provided. So for him, staying in Malaysia is totally fine. But of course, he has some barriers like language barrier and etc.
Okay. Has any health facilities given to them?
for
They
no,
don't they don't get any particular health facilities as such, sir. But also then they have this habit of not really seeking healthcare also because they're scared of the costs involved.
Okay. So, I mean, these are illegal immigrants or migrant workers. So there could be some kind of a difference between the two, right?
That's
Yeah,
true.
Hmm.
yeah.
Okay, for those who are coming with the permit, right, Dr. Ankur,
Hmm.
those that means the employers they are responsible to provide the medical services to the foreign workers. But those who are with the illegal immigrants, there are about 4.5 million illegal immigrants in Malaysia at the moment. So of course for them, accessing to certain necessities, of course they will find some difficulties, especially for health services.
So these illegal immigrants actually don't have any kind of a identity in Malaysia.
they don't have any identity in Malaysia, but most of them are employed also. It's just that they didn't show it or what. But if they work in, let's say in the palm oil or what in the companies, right? They will have the estate small clinic, something like that, which is work under the company to cover their some basic healthcare services.
Is there any kind of a identity card or anything issued to
No,
them?
No.
They don't have nothing.
for what I understood, right? I get to know the one of the company of the palm oil, not to mention that those illegal workers, right? If they have any problem, any diseases, whatever, maybe they are blind or what, right? They were just buried somewhere in the estate without anyone knowledge.
Okay.
Yeah.
So, uh, I mean, if somebody becomes pregnant, then they have to pay from their own pockets for the delivery, or if they want, I mean, or the government actually provide the facilities.
I think they will just deliver by their own because they are illegal. They cannot bring it there because usually they will work under the estates, right? If they just go to the clinic nearby, right, the company will be fine. So usually they will just hire their own clinic, estate hospital, those healthcare workers to actually settle all the issues among those illegal by themselves.
Okay.
Yeah, that's what I know. And usually those illegal they will come in a whole family. So actually they will provide some education background for them, for their children, for their kids, and something that they can take care of themselves, so that they will have less problem, so that they don't need to access to the hospital or what that frequent.
Okay. So, is there any measure taken, like any kind of, say, uh, plan is there to send them back home, and or in Malaysia itself to make them settle down? Is there any plan by the government?
I'm not sure for that for the government.
Okay.
I have a question, Dr. Anko. If there is
Yes.
no any sort of identification, then how would the government know if they're illegal immigrants or the legal ones?
Yes, that's the point actually, how the number is coming. This
They will
4.5
need to take
million.
All
So
passport.
right.
it's sort of
Because if I'm assuming because they are given a job legally, then they probably have an identity card or something. The illegal immigrants will have absolutely nothing.
Yes.
yes, that would be the only
Not
way
have
you
nothing.
can
They will still have the passport. It's just that it's not the real passport that they paid for. The passport without visa, they are all illegal.
So how will you know? How will a person know if a person
Okay.
illegal
Uh,
or illegal?
all right. What happened is, the migrants are not necessary to be foreign workers, right? It could be anyone. So, especially those who are coming as a refugees to Malaysia, what happened is they are taken care directly under the United Nations. So, for them, they will have some sort of identification to indicate that they are refugees. And
Yes,
for
this is a point.
mm,
This is a very important point.
yeah,
Refugee status is given by the UN. So if
yes,
they can get the refugee card, right, they
yep.
get certain facilities there.
True. And what happen is for these people, mostly the NGOs will be, they will take part actively to take care of them. So some of the measures that will be taken is provide them education. For example, those Myanmar people who are coming as a refugees to Malaysia, they will be provided some basic education like English and etc. And of course, all their all their healthcare services, everything will be directly monitored by United Nations. So once they, oh, this interruption. So once they have that basic education, so what will happen is these people will then be sent to some, like for example like US or London, to fill up all their essential jobs, okay, where they are required. So in this way, they will be, the United Nations will be monitoring their progress right directly as of in Malaysia.
So they are rehabilitated in a better way.
Correct.
Right. Now, the point is that what is the criteria to be declared as a refugee and not an illegal immigrant? How these two categories are different? So this one actually, I think you need to do a little bit research on the net, especially the UN website, to
Mhm.
see what are the criteria that
Mm.
somebody can be declared as a refugee,
Okay, sure, we will
right?
do that.
Yes, because you can from your discussion it is very clear that both these categories are not having the same facilities, right?
Yes,
Illegal immigrants and the refugees. There is some wide gap between the two, all right?
yes,
And
correct.
so also the foreign workers. I mean, there should be a difference, right? If you're
Yes,
immigrant or
foreign workers can be on a job contract.
Mhm.
Like us, we are in a foreign worker, we have a job contract. So when the job contract is there, there will be health insurance and EPF and all the stuff will be there. Social security, some kind of a thing is there. But if the job contract is not there and the visa doesn't have a work permit, then becomes a problem, right? Then
But
it become like,
sir, that is the
hmm,
thing also when there are people who, the ones that we call migrant workers, they are the ones who work in lower class people who work in say restaurants or work as maids or something like that. But
actually, migrant worker, foreign worker, illegal immigrant, and then your refugee, right? These terminologies have to be very clear in your mind, right? Who belongs to which category and what is there and what is not there as facilities for them. Got the point? So the
yeah.
definition has to be clear. That's it. So, I mean, mostly you have, if any one of you have got a real experience, you can share with us, real-time experience of interviewing any kind of illegal immigrant or migrant worker like that, or a refugee. You can share with us the experience.
Okay,
Okay, not yet, right?
what
Okay,
I
then
what
tell
I
me.
know that a person can be said as an illegal migrant, even for example, let's say if they get a permit to work in Malaysia under, for example, plantation industry, right? But eventually they are not working in that sector, and they are working in some other sectors. They can consider to be illegal as well.
Yes, this
Yes,
is one very important point. Here
yeah,
in Malaysia, it is not a universal job contract.
yes, correct.
The visa will be related to a particular job. So they are supposed to do only that one,
That's true.
right? Hmm.
Yes,
As compared to that, certain other countries, it will be a blanket
universal,
job
correct,
permit. Yes, you
correct.
can do any kind of work there. That's the thing. Yes. So, any other question which is coming from the slides in your mind, you can discuss. Faiza wanted to contribute something, right?
No, sir. I was just a bit confused between the
Hmm.
foreign workers and the if there is no sort of identity between them. I mean, how can the government actually say this is an immigrant or this is an illegal immigrant?
Yes, illegal immigrant, that number in any country is not a complete one actually, it's not an updated one.
Because I'm just thinking all these, let's say the maids, the Filipino maids that usually come into Malaysia to work in a particular place, and then they leave the job and they go to another place. Are they considered illegal too, even though
Uh,
they have a visa to stay and all that?
yeah, within Malaysia, as Auntie just pointed out, uh, they might be employed for a particular worker, right? Now,
Yes.
without cancelling that work permit, if they join some other worker and start working there, then it is illegal here.
Yeah, but there's no.
Sorry, you unmute yourself. Faiza, you unmute yourself.
Yeah. So what
Is
I'm
it?
saying, if they have a work permit visa
Hmm.
to work, and they left the place where they're supposed to work, they work another place. Even if they get caught, they can't really tell them they're illegal because they have work permit visa.
But in Malaysia, it will become illegal because the the employer is different, right?
Yeah, so that means the visa is actually attached to that particular employer.
Yes.
Okay. Okay. I understand.
But actually, what happens sometimes, you are very right. If the workers are coming from different countries with a low socioeconomic background, right? They have a plan to settle here, right? So they might destroy their visa and passport themselves, and they say that we don't have anything, we are brought illegally here, and they try for a refugee status. That could be
that
one
they
of
have
the
to go
things.
through the UN.
Yes.
Okay.
So, any other issue?
No, sir.
You can check the YouTube for some videos of interview with the migrant workers and the illegal immigrants or the refugees, and then you can get some more idea about their socioeconomic background and their challenges, right? That will help you to answer the question better.
Okay, sir.
So we should know what are the difference between the refugees, the illegal migrants, as well as the foreign workers, right?
Yes. And please note down that disclaimer statement which I put on the chat on your right side.
Oh.
You cannot copy paste from this chat, just type it in a Word file and later on put it in your slide, the second slide.
I'm so
Because
sorry,
here,
Dr. Anku, would you repeat it once again?
it is here actually. You just see the right side, the chat is coming, right?
Yes.
Group chat. Can you see there?
Yes.
Yes. There you see the views shared here are personal research views of postgraduate students. It may vary from institution to institution.
Yes, we see that.
Statement. Yes. Unfortunately, it is not letting us copy paste.
No, we can copy and paste.
You're able to do that? Okay.
Yes.
Then put it in the second slide. This is for all our presentations because these are all our own views, right? Not having much of say evidence. So that's the thing.
So we should put this on the slide, is it?
On the second slide, I think.
On the
Second slide of all the presentations.
Okay, sure.
4 presentations you have, right?
Can you
You
show
put
us
it
the
in the
second
second
slide,
slide.
please?
I mean, after the title slide, insert the disclaimer statement.
Okay, sure.
Here, this is the second slide, sir. The contents,
Yes.
just before
So
the contents.
before that it should go.
Okay.
Okay, on top of the slide, right?
This is your title slide. The first one is the title slide. After that, content one, you make it third slide.
Okay. Oh, okay. So it should be a slide on its own.
Yes.
Yes.
Okay.
So then after that you upload on our portal.
Okay.
Okay, sorry. You hold back for a few days, one or 2 days, because I have to upload your names there, names and the registration number.
Okay, sir.
That is not there because so far I found that the student cohort is showing. Right?
Okay, sir.
Okay then, thank you very much. And we end our presentation here. You let me know when we can have the next session, right? Either tomorrow morning or Friday afternoon.
I think Friday afternoon will be fine.
Friday afternoon will be better. Okay, fine. So you just talk to everybody. If they are ready, then we have it on Friday afternoon between 2 to 4, right?
Yes,
Yes.
sir.
Okay then. Thank you very much.
Sorry, sir.
Yes.
Sorry, I'm not going to be available Friday afternoon.
Okay. Then some other time, can you present your section?
Okay.
Okay, we
The
will discuss
portion.
and let you know when we will all of us are available.
Saturday we'll confirm with you, sir.
How
Otherwise,
about
Saturday
tomorrow?
also fine.
How about tomorrow?
Yeah, tomorrow evening also it is possible. If you like.
Yeah, because I'm
Tomorrow
not going to be
afternoon is not
available for the
possible.
weekend. For the
Tomorrow
weekend, I'm not going
afternoon
to be
I shall
available.
not be available.
Okay, we'll discuss it and
Correct. So thank you very much. We'll end the show. Have a nice evening.
Same to you,
Thank
Dr.
you,
Ankur.
sir.
Thank
Bye, sir.
you.
Okay, bye then. Yeah.
thank you, sir.